Good evening, everyone, and Assalamu alaikum rahmatullahi wa barakatuhu. Greetings from Melbourne, Australia. This is Mohammed Waqas Qureshi back again on live on Voice of Australia at your own show, Live with Waqas. I hope you're all having good and great cold weekend at the moment. We're having 11 degree at the moment and currently cold and cloudy out there. I'm having a cup of tea ready with me, and we have very interesting topic again and very informative program too. Our today's topic is very imperative, and I would say it's sensitive too, as it is related to our health and well-being, which sometimes leads to the mental stress and other psychological issues which we are facing collectively as a community, as a society, and as a global world as well. We are going to discuss about the misconceptions and misunderstandings and fear we are facing in community with regards to the COVID vaccine program happening in Australia and happening all over the world with our loved ones who are living different parts of the world, because we have a families which is not all living in Australia. So this is the topic, and we have a very special guest with us. So for this, I have invited very distinguished guests who would be addressing those issues very minutely and cover the government and official stance as well, because he's representing the Department of Health, and he's very well-known personality, known as the champion of clinician vaccination program from the Department of Health Victoria as well. So I would like to invite, and I would like to introduce Mr. Stephen Liu, and who has a great personality, who would be asking those questions. And we will be asking those questions from him, and he has a vast experience about the whole program. So his specialty is he's specialist general practitioner, clinician vaccine champion, as I mentioned, and he's a fellow member of the Royal Australian College of General Practitioners, RACGB. He's a member of the Fellow New Committee of Victoria and also the Educational Supervisor of Eastern Victoria General Practitioning Training Department. So I will take a quick break, and after that, I will welcome him at my show. Thank you. Dr. Siwan, have a very warm welcome at our show, and I would like to thank you, and I'm very humbled to come at our show and address our audiences. So off to go. Before we start, I would like to give you a small disclaimer as well, that we are not sort of any anti-vaccine understanding people as well. We are having this clear knowledge. We are not the person who are believing as well that it is a chip in your body, and if you slide the magnet on your body, it will gonna get connected and attracted. Neither we are going to discuss about the 5G technology and all those conspiracy theories which is happening all over the social media. But we're going to be discussing the genuine, the concerns of the society and the community, which vaccine going to be using in the society, which is ideal, which is not ideal, depending on the efficacy of the vaccination as well. So before I start the questions, I would like to give you the platform to start your address with the community and tell them about your role, what you're doing, and how we are doing collectively as Australia, and where we are leading our world onwards in the future. Thank you. Can you hear us, Dr. Stephen? Yeah, beautiful.
Yes. You can hear me clearly?
Yes, I can hear you, Dr. Stephen.
All right. Well, thanks for that. Very, thank you for your kind words. A very warm welcome, Waqas, and it's a pleasure to be on your program. So Stephen's my name. I'm a specialist GP. I'm also a member of the Royal Australian College of Practitioners, and my role here tonight is representing the Department of Health as one of the clinician vaccine champions. My role in these settings is mainly to come on and answer some questions from community members and community groups about COVID, about the pandemic, and more importantly, about the vaccination program. So any progress, any concerns, and it's very understandable that there are concerns, and our role as clinicians, as providers, is to listen to these concerns and address them. What we want to do is to communicate some good, accurate information that addresses these concerns, and hopefully dispel some of the misconceptions and misinformation that can spread on through different mediums like social media. And I'm happy to answer all of these questions.
Beautiful. So at this stage, I would start. My first question would be that what's the main reason and why the people are so skeptical about the vaccines and having doubts about it, considering that this is the only remedy and only the solution at the moment?
So I think we can start talking about why it is an important and potentially the most important solution. So everything that has been done so far, and I would say Australia as a whole has done this exceptionally well, which is to protect our communities from having widespread damage from COVID. So we've been very fortunate and very lucky not to see the death and destruction that we've seen COVID cause elsewhere in the world. We've been able to do this through the measures that I think most of your viewers are quite familiar with. We socially distance, we have lockdowns where necessary, and we have contact tracing, and we wear masks. So all those things are incredibly important. They still are very important, but all of these measures are ultimately a protectionist approach. It doesn't actually fundamentally solve the problem. And if we want life to return to normal, it will depend on vaccines. And again, our advantage is we've been able to learn, and we see the evidence from various places overseas. So we've already had quite a lot of different countries vaccinate a very, very large proportion of their population. So countries like America, like the UK, like Israel. Once you can see these were countries that have not, unlike us, I wouldn't say that they initially controlled or contained the virus as well as we have. I think they've seen a lot more death and destruction than we have. But they're in a place now where, take a place like Israel, I think they've reached, beyond 70% of their populace have been fully vaccinated. And life has been allowed to return to normal. In fact, my understanding is they're no longer wearing masks. Businesses all going back to normal, and life coming back to normal. And it's important for us to know that this is certainly not finished. The pandemic is not finished, and I don't think it's potentially ever going to completely finish. I think we all have to come to terms with the possibility that we will be living with COVID in the foreseeable future, and how we are able to reach a place where life can return to normal, much like in the US or in Israel and the UK, depends on mass vaccination. So we do need what we call to achieve a level of herd immunity, where enough of our population are vaccinated, so that the virus is not able to sort of pick up any traction.
Beautiful. You have explained very well and quite in detail about that how Australia is doing, and we are really thankful and humbled. And when we see all around the world and social media, when the videos are coming that we don't have even, like say in Delta variant recently, we don't have the coffin for our dead bodies. We're having lack of oxygen cylinders. We have lack of oximeters and all those things, and prices were shooting up, and we will not even given a care, regardless even we have money.
Very harrowing things.
So these are happening and all, and somehow directly and indirectly we are attached with them as well because of the vast community of immigrants here in Australia. But my question is that, Dr. Stephen, that as you mentioned that we did very good, but according to the resilience ranking in Bloomberg, which has recently come over, and they were saying that, as you already may be aware of the stats and all, it's probably 1 week before ranking, which mentioned that China has already done 40.8%. France and Spain has already done more than 40% above. USA has completed 50% of population vaccinated, considering their population is more than Australia. But if you compare and you already mentioned Israel, which according to my stats, it's 59.1% back in a week ago. But now obviously you're saying 70%. But considering the Australia, the report saying it's not something very promising, that Australia has done only 14.2%. So my question would be like, what makes Australia, considering that our borders are closed, or we don't have sort of panic situation, our health system is not under the pressure, but still we have only done 14.2% of population vaccinated, considering the population is not that too much.
Thank you, Waqas. That's a very astute question. We have noticed, so we'll talk globally first, then locally. So globally, we have noticed that countries that have really done very well in the beginning of the pandemic, so we're talking about places like Australia, like New Zealand, like Singapore, like Korea, the places that have been able to contain the virus more effectively. So we say contain the virus more effectively, have picked up their sort of vaccination, this is not the only variable, but this is just a sort of correlation that we've noticed, have not excelled as quickly in the vaccination program. And one of the things that I'm here to, I guess, communicate is it's entirely understandable that when we haven't faced the sort of death and destruction, when we haven't really, it's not in our neighborhoods, it's not up and down the street, the level of urgency that one faces when making a decision about having a vaccine can vary. And that's part of my role, which is to come and communicate more vaccination confidence, to reassure patients and to reassure community members that it's safe, to provide information so that we can get the vaccination program on more quickly. People, we do enjoy a level of freedom where people have a choice, but we would like to encourage everyone to make that good decision. Now, in terms of the vaccination rates, there's quite a lot of different variables here, but the vaccination program is underway, particularly in Victoria. It's going quite steadily, and we hope for this trend to continue and grow even faster. So the analogy that I sometimes tell my patients is if we all lived in if we all live in the city and we live in different apartment buildings, and there's a fire burning through these buildings, our building hasn't really caught too much of the flames, right? Whereas if you look overseas, in countries that have really been ravaged by the virus, and it has really caused a lot of death and destruction and heartbreak, much like what you mentioned earlier, Waqas. The incentive, the drive for us to find any form of protection is much higher. I don't think anyone will be asking questions about, which vaccine should I get. I think people will just want to get whatever vaccine they can to protect themselves from a very, very real and high, and likely threat. Whereas we enjoy a level of safety. I mean, but things can change very quickly. Just much like what we're seeing in Sydney, things can change quickly, and the protectionist approach is not going to restore our lives to what it was.
Beautiful. No problem. So in terms of Australia's strategy and the way we have tackled the COVID, it's no doubt it's quite exemplary, and we don't have as much as deaths, and we don't have as much as cases as compared to still coming in the third world. And considering even we haven't done the vaccine though. But my question is what's the strategy? What's the main goal of the government? Where we recently, announced the 4 stages where we're going to go to the normalcy. Right, yeah. And in the when you say the normalcy index has come as well, where I believe I just have seen that before. Hong Kong is number 1. Second is New Zealand, and Pakistan is number 3. Considering they have the many cases all around, and they are having deaths as well, but they are leading to the normalcy as well, according to that index. But Australia is nowhere in like nearby in the very promising countries. So when you say about the normalcy, it's not something we are in obviously sick or something, but other directly things as well, that the borders are closed. Our social impact is very huge as well. We cannot meet our beloved one, which is overseas, and half of the families are here. And we are, I think, one of the country which is, I think, New Zealand or Australia. Not many of the countries has all closed their borders like what we have done in Australia. So, do you considering the social impact and the economically impact as well on the long term on the Australian nation and population?
So, absolutely, Waqas. The way for us, because like you mentioned, we're not facing as much death and destruction. What is much closer to our hearts, right, and much closer to to our local community members, is being able to restore our lives to what it was before. We all have, myself personally, my father's in Hong Kong, and I've got a 3-month-old daughter that he hasn't met, yes, we do. Yes, we do Zoom and we do the FaceTime, but that's not the same.
Exactly.
And this is just one, and of course that's nothing compared to families who have lost loved ones to COVID. But here in Australia, my story is certainly not alone. We've all had to deal with the difficulties and the aftermath and the flow-on effects of not just the pandemic, but also the measures that we've had to take to protect ourselves from the death and destruction. The difficulties with work and with business and with family, and the way out of this has to be, and as I sort of mentioned, has to be being able to vaccinate a significant amount of the population so that we have enough immunity that we can safely open up, much like the federal outline plan.
Beautiful. All right, I'm going to take a question slowly. Maybe you can see on the screen as well, the people, they are watching us all over the world, and especially in Australia as well, and they are asking the question as well. I will take the questions slowly and gradually as well, but I will take those questions which are generally already been given to me by the community and the people of my team, which is working on the back. So I will go specifically in Australia because we are living here.
Of course.
My understanding is, Dr. Stephen, that we can take either AstraZeneca or Pfizer, which is not readily available considering that. So do we have option here to take either Pfizer or AstraZeneca at this stage, or whatever is available, we should go for it and take it straight away?
Okay. So for starters, you're right. The two types of vaccines that are available to us in Australia at this point in time are Pfizer-BioNTech and the AstraZeneca vaccine. So they're the two main ones that are recommended. Now, the current recommendation, and I should say the current eligibility, is that if you are over 60, you are eligible for the AstraZeneca vaccine. If you're between the ages of 40 and 60, you are eligible for the Pfizer vaccine. Between the ages of 40 and 60, you do have a choice of choosing the AstraZeneca vaccine instead of the Pfizer vaccine. And the benefit that would be perhaps you can be vaccinated sooner because of availability. Now, my recommendation in that, if that's something that you're considering, is to speak with your local health provider, speak with your local GP, and it's important that all our community members and our patients make an informed consent. So our job is not to tell you what to do. Our job is to provide you with the most relevant information and help you guide you to a decision that addresses your own concerns. Now, that does not include patients who are eligible for medical reasons. So if you have a chronic medical condition, whether that's any sort of blood disorders, diabetes, coronary heart disease, kidney disease, neurological conditions, having a disability. The eligibility would then widen beyond the age group. And the best place to go is actually, there is a very, very easy to use COVID vaccination eligibility checker online. If you just Google that, or it's actually from the Federal Health Department. It's a very easy interface, and you can click through, and it will tell you about your eligibility, and that also takes into account your what sort of work you do.
That's quite handy, I would say.
Yeah, it's very good. I've used it myself. Yeah.
Oh, did you? Oh, beautiful. Before that, Dr. Stephen, when we given considering in Australia that we still have not been given sort of restriction or sort of the command from the government that you must have to take the vaccination. This is not the condition in Australia, considering in other countries, especially underdeveloped countries as well, and even the Middle Eastern countries as well. My family is living in Saudi Arabia, and they were mentioning that they are saying that the police is literally giving the fines if you have not taken the vaccination. In Pakistan, they are cutting your salary if you're the government employees, and because the vaccination is available and the people, they have the second thoughts, and they are making sure that most of the population take the vaccination, so they will lead to the herd immunity and they will go to the normalcy. But here in Australia, on the one side, we are closing our borders. On the other side, our vaccination is very slow. So my question is that what makes the nation of Australia to take a step forward and go voluntarily giving the vaccination? What's your expectation that do you think we can achieve 60%, 70% population voluntarily to take the vaccination, considering that we have all those concerns and misconceptions and some conspiracies as well?
Yeah, thank you. So it's very difficult to compare various governments based on the type of government and based on what tools might be available to those governments. But I can only describe the situation that we have in Australia. We are not going to, certainly the Department of Health or your doctors are not going to force you to have the vaccine, and I don't believe at this point you will be penalized for not having the vaccine. And I want to say that even though we may have had a slow start, the vaccination program is going forward quite steadily, and I reiterate that it's going forward steadily whilst we protect our populace, with the border measures and with contact measures, and they have been quite inconvenient. But I don't think more drastic measures will be necessary. Certainly, that's. I don't think those tools are available.
So do you think we will not lead to that stage where we will get the fine, where we will get penalization, and we will not lead to that stage? Do you think?
Well, the polls and the evidence that we have is that our populace is for the most part are very pro-vaccination. They do want to get vaccinated, and I think that will suffice, and I think that will take us to the level of vaccination that we need for herd immunity. Now, that's not to say that our communities and our community members don't have concerns about the vaccination, and that's what I'm here for. I'd like to answer any and all questions about any concerns about vaccines, any misinformation we'd like to dispel. And as healthcare providers, it's very important for us to not just communicate the science, but also to genuinely listen to concerns, because it's like you mentioned at the beginning of the program, it's taken a big toll on people's mental health. We are, even if you're not fearful immediately of getting COVID or dying from COVID, it's caused a lot of stress and a lot of anxiety for everyone. And I think all the more important for everyone to be heard and have their concerns listened to by healthcare providers. So that's what I'm here for.
Beautiful. Thank you so much, Dr. Stephen. And I'm getting a lot of comments as well on my WhatsApp groups as well of our channel and our live Facebook as well. Probably you can see a few, and I can see all of them. And people, they are really thanking you, and they are really humble, and that something you are clearing their misconception as well. With regards to
That's very kind. Thank you.
yeah, with regards, let's come to the efficacy, because these are the terminologies.
Sure.
When you see that, when the vaccination were rolled out back in 19, I think in November, December, they start coming. First we heard
Yeah.
Pfizer, and
Yeah.
after that Pfizer, AstraZeneca, and all. We were going according to the vaccination as well. So the richer countries, they're keeping those medicines which are having the highest vaccine efficacy as well. And then some people, they're believing on the brands, then they got brand conscious as well. And I remember, like back in a month ago, President Biden has announced and did the generous announcement on the press conference. He was like saying that he has a backlog, a lot of the AstraZeneca in the United States, but it is not cleared yet in America by the FDA, to give it to the local people. So he's going to donate 60 million of AstraZeneca to the rest of the world. So do you know where I'm coming from? That the question arises, it's not even approved yet in America, and he's giving it to the other people. So why they did not approve in their own country, and then before giving and rolling out to the other countries, just because their priority is to give the more good efficacious vaccine to Americans, or are we more immune with the AstraZeneca vaccination?
Okay.
Sorry to sound political, but
that's okay. Look, so I can't comment on the FDA, which is the equivalent of our TGA, so the Therapeutic Goods Administration, right? So like you said, this is very much sort of government administration politics, but so I can't comment on that. What I can comment on, and I think to address your question, we want to take it a small step back and say, what are the different outcomes that we want to achieve with any COVID-19 vaccination? So, it's not just AstraZeneca and it's not just Pfizer. There's also Moderna. There's also Johnson & Johnson. There's I think there's a Russian vaccine. There's Chinese vaccines. And there's quite a lot, right? So before we get into which type, I think it's important for us to consider what are the different outcomes of someone being exposed to COVID-19, and what is it that you want to try and achieve with any vaccine? So obviously the best case scenario is you don't get sick at all, right? And the worst case scenario is you die, right? Is you die from the disease. But it's important for us to tease that out, right, and have a more nuanced way of examining it, which is in between. There's between not being sick at all and death, right? Between those two goalposts, there's quite a lot of steps in between. So you can be hospitalized, you can have severe to moderate symptoms, or you can have no symptoms, very mild symptoms, or you can have no symptoms at all. So when we then look at words and descriptors like efficacy, it's important for us to tease that out as well. So what do we mean by efficacy? Where is this information, how do we gather this information? And more, the more relevant thing is, do these vaccines achieve, what do these vaccines actually achieve? So the efficacy is just a number, but what we want to know is, what does it do for you as an individual if you had it? So the important thing, I think, for us to know that in terms of preventing severe illness, all of the vaccines that I mentioned, including, based on the data, including the ones that we don't have here. So Moderna, I think Novavax and Johnson & Johnson, all these different vaccines, all of them have been shown to prevent severe illness and death, which is fantastic. And I think they're the markers that we really want to look at when we compare vaccines. So again, the analogy that I sort of use is, if your building's on fire, we're sort of comparing, fire extinguishers.
Makes sense.
And if the fire is really raging, all of the fire extinguishers will work for you. But for us, because the fire's not really, it can tip over, right? It can tip over. Things can change very quickly, but at least we've enjoyed a level of safety, so that we do have the room, right? We have this buffer. We have a level of comfort where we can examine it more deeply, and that's not just individuals examining it more deeply. I think our government does too, right? So, for instance, the Australian Technical Advisory Group on Vaccines, the ATAGI, who makes a lot of the specialist group that makes a lot of the recommendations to the government. We do take these things into account. Now, to address your question about efficacy is ultimately, it's very difficult for us to condense the effectiveness of a vaccine down to just one number, because the efficacy is mainly we've given, and these numbers are what we got from the clinical trials. Right, so the clinical trials done for Pfizer did show that it had a very high level of efficacy, to say that the people, we give half the people in an experiment the vaccine, and we give the other half a placebo, and then we see which group got infected, and that's how they calculate the efficacy rate. But there's a big difference between getting it and not getting it versus getting it and preventing severe illness. Getting it and preventing you from having to be hospitalized, to go to ICU, to be put on a ventilator. So it's important to make that distinguishment. And also, some of the clinical trials were also done at different periods of the pandemic, because this is an unprecedented situation. So the Pfizer vaccine clinical trials were done, I believe, quite early on in the pandemic, when the virus was not as widespread. It was done in America, and I think it was done over summer, when the risk of infection was actually a little bit lower. Whereas the AstraZeneca clinical trials were done, the data was not collected, not just was collected across a few different countries. So there are limitations to our interpretation of, if we want to just focus on the efficacy rate. But my recommendation is we focus on does it prevent individual bad outcomes? It may not prevent you from getting the illness at all, but what it can do is prevent you from dying from the illness. It can prevent you from having a serious illness. So potentially you might have very, very mild symptoms, but what we want is to shift people from
thank you so much for explaining in detail. Like, you give me the good idea now and sense of efficacy, how it works. But while you're explaining me the efficacy, my general understanding is now that any medicine, any vaccine which is working for you, regardless what's the percentage of the vaccination, we should go for it according to depending on the availability. But if I'm right,
Well, every individual has to make a risk assessment for themselves. So our role as care providers and as vaccine providers is to make sure we communicate very clearly and guide you to a good decision. So if we lived in, I think if we lived in America, or if we lived in Brazil, or if we lived in India, where there's quite a lot of community spread, and there is more, at one point, more death and destruction, that we have to factor in that background risk. Whereas because our background risk is quite low, I think it's more important for us to address any concerns. You can have quite nuanced concerns. You might have read something, and the thing that we haven't spoke about yet, which I'm sure we will, is about sort of the risk of blood clots with AstraZeneca. It's entirely understandable that we have these concerns, and it's important. So my role is to try to provide information and guide these conversations, and provide information to contextualize these risks.
Yeah, I got one more question. If that's the thing scenario, then Sajid has got the question backstage, which I want to also start taking the question as well because we're running out of the time.
Certainly.
So my questions will be also those questions which are coming right now, and I'm reading on the screen as well. One of
Yep.
the overseas person, they want to come to Australia and they want to apply the visa from Pakistan. And in Pakistan, as far in my knowledge, is we are taking the Chinese vaccine, which is readily available. And the Department of Immigration and the Visa Authority, they have mentioned them because you have taken the Chinese vaccine, you would have to take the either AstraZeneca and the Pfizer. So I don't want to get into the political answer, so sort of the in this debate, but I would like to know from you being a medical doctor that what will be the medical impact on the person who already have taken two doses of any
Yep.
other brand vaccine, which is the less efficacy one, and then if he's been compelled to travel for traveling to take the vaccine, which is only allowed in specific countries like AstraZeneca and Pfizer in Australia. So in that scenario, what person should do?
I see. So, so first of all, from a clinical point of view, there is no risk that we are aware of that has been demonstrated in any data that having a different vaccines will be harmful. So your viewer, if they've had the Chinese produced vaccine, if they then subsequently get either AstraZeneca vaccine or the Pfizer vaccine, that would be very safe. In fact, my father had the Chinese produced vaccine first, and then he was subsequently vaccinated with the Pfizer vaccine, and that's entirely safe. So from a clinical point of view, I think that's entirely fine. Now, in terms of what is accepted or not from an immigration point of view, I can't really comment on that. But if you reach out to the Department of Health, we should be able to provide you with an answer.
Yeah, no problem. Thanks, Dr. Stephen. We're only talking about medical and clinical side effects and the issues at the moment. Obviously, with the health, immigration, and political issues, which is connecting to us, which making the hurdles. But we're not going to focus on those things. But having said so, I also heard from one of the relative, which is in Saudi Arabia, and he mentioned his name is Umar Sadiq, and he just sent me a message to ask from you, dear Dr. Stephen, thank you so much for having time with us. So I would like to ask a question. He has taken the first dose AstraZeneca, and then he has been told that the second dose was not been available, so it's safe to take the Pfizer as well. So now he's a bit not sure about that. So, and he's concerned about the side effect by taking the two.
Where is he?
In Saudi Arabia, he has taken the AstraZeneca first. Now he got the second dose as a Pfizer.
Yeah. Okay. So again, like I mentioned earlier, that it will be very safe to have. And in fact, there has been. We are still. So I stress that this is not the official position of the. Not the official recommendation made through the Department of Health, but there is. We are noticing, we're still collecting data, and overseas we have data on patients that have been vaccinated with different vaccines, and there has been some evidence yet to be, I guess, taken on board in terms of policy, but to show that can be quite, not only quite efficacious, but quite protective against various strains. So not only will I have any concerns about having for your viewer, having first a AstraZeneca vaccine and followed by a Pfizer, I think that will provide him with the protection. It will not predispose him to any increased risks, and potentially can be quite protective against various variants.
Yeah, because recently we heard as well in news that I think WHO officially said that mixture of the vaccine of AstraZeneca and Pfizer in some countries, it worked efficiently as well. Dr. Stephen, I will take a short break quickly, and then I will go to the question as well, because we're running out of the time, and I don't want to take you a long time as well, considering we have vast amount of the questions at the moment in front of us. But obviously with this, the limitation of time, I won't go with all of those questions. And I do apologize if I miss any question from the viewers. Please let me know and send me a message, and I will definitely forward to Dr. Stephen, and in the back, we will get your answers as much as possible. So we'll take a short break. Thank you.
Certainly.
All right, welcome back. Thanks, Dr. Steven. We had a short break. Now I'm going to go quickly with the comments and the appreciation you got. You are going to be a hero in our community and the channel now. So everyone is
Very kind, thank
appreciating you, and considering that you have a family, 3 years old and 3 months daughter as well. And Dr. Atif Janzeb commented, very informative and great work. Thank you so much, Atif, for your kind feedback. I definitely passing on to you, Dr. Steven. Aisha Awan is saying, great question. So yeah, this is very great discussion going on. Thank you, Aisha, for your support. Sajid Tori is saying, very informative show. Thank you, Sajid, for your kind comment. Naz Mehman is mentioning she has a question. Will the AstraZeneca COVID-19 vaccine be effective on new variants like Delta or other new ones? And adding to that question, I would like to also add, one side, our Prime Minister Scott Morrison mentioned that we are going to deal it as a flu. And on the other side, we got the Lambda variant as well, and which is very sort of aggressive, and it's very dangerous as well, as what we are hearing at the moment from the media. So please join those two questions and comment on it. Thank you.
Sure. So first of all, based on the way the vaccines were designed, and it's really technically very impressive that it should have efficacy against different variants of COVID. Now that is not that is not going to be the conclusion. The way we draw any insights from this has to be anchored in data. So we have to look at evidence, we have to look at data, and data is being collected not just in Australia, but more so across the world about how different vaccines protect against different variants. We do know that the vaccines will protect you against the variants, but to what degree, we at this stage we can't give you an exact number, because that information and that data has to be collected. So we have to collect the evidence before we present it. But certainly, any vaccine will be better than no vaccine. And having any level of protection is significantly greater. It offers you significantly greater protection than having no vaccine.
Beautiful. And I'll go for the next question. Thank you, Dr. Lu. And Sajid Turi is mentioning that how long will the vaccine protect person? So for further more detail, I would also ask, but after 1 or 2 years, do we have to take the vaccine again? Or is that something like the normal flu vaccine we are taking every now and then?
That's a great question. Thank you. So the short answer is, at this stage, we are not entirely sure. But it is looking more and more likely that COVID will be something that we all have to live with, much like the influenza. It may be necessary for us to have, and again, we have to, the answers to these questions have to come from evidence and data. But so far, what we've observed is it is likely that, we will have to live with this. And what that means is then, it is likely that we will need further boosters. So for instance, you might have had your 2 AstraZeneca vaccinations this year, or you had your 2 Pfizer vaccines this year. It may be quite likely that next year or the year later, you may need a booster shot, and it may even become like the seasonal flu vaccination where we need a booster of some sort every year. And bear in mind, this is something that's only been around for about a year and a half. So we are collecting more information to answer these questions. It may even be that we will be, as we sort of mentioned before, we will be having booster vaccinations with a different type of vaccine. So if you had Pfizer, you might have AstraZeneca, and vice versa. We're yet to see, but it is likely that we will need to continue to have further vaccinations.
Beautiful. Thank you, Dr. Lu. I will go to the next question. Aisha is asking, can we also find out that are there any long-term side effects related to the vaccine? We know that there is a nausea, headache for the time being happening, but my concern is we have listening many different things as well, making the men infertile, female infertile as well, especially. And does that rings the bell or is alarming, sort of any
Okay.
non-vaccine?
So this is a very good question. So there is no known demonstrated long-term adverse effects to the vaccines. You did mention there can be some short-term adverse effects, much like with any medicines, much like with any vaccine. Yes, the ones that we have now can cause a little bit more sort of sore arm, redness at the injection site, muscle aches. It's more likely to occur than with the normal flu vaccination, but there is no known long-term side effects. And certainly there's no evidence that it affects the fertility of men or women. In fact, and again, we're in a very lucky position that we can look to the evidence and the data that have been collected overseas, where there is much higher prevalence of COVID and much higher prevalence of both vaccination and COVID, where we're now in Australia, we recommend pregnant women, also eligible pregnant women, to receive the Pfizer vaccination as well. So there's no demonstrable long-term side effects. I have heard concerns about people saying, could it change your DNA? And look, I think that's a valid question, because for instance, the Pfizer vaccine does work based on mRNA, so messenger RNA technology, but it doesn't. But there's no evidence that it enters your DNA. So it actually all its effects occur outside of the nucleus of the cell where the DNA lives. So there's certainly no evidence of that happening either.
Yeah, beautiful. I got a next question as well, which is from my mobile. My friend was asking not to mention his name because he want to make a surprise. He's expecting baby, but you already mentioned, is that safe to take the vaccine for his expected partner?
Yes, and I stress that these decisions are made following a careful examination of the evidence. So prior to this examination, so for instance, I think around sort of March, April, I would receive the same question, and at that time, my recommendation was, again, based on the official scientific recommendation of the ATAGI, is that women preparing for pregnancy, women breastfeeding, and post-delivery can receive the vaccination. And following examination of further safety data, from overseas, we've now expanded that to include pregnant women as well. So the recommendations do change, and I think it's important for listeners and for viewers to know. Sometimes we change these recommendations not because we got it wrong in the first place, but we build on further safety information and update our recommendations accordingly. So when there's changes, by all means, if you have any concerns, please ask questions. You can attend to your local doctor, your GP, and you can ask about it. We really encourage that. You can visit the government website has actually scaled quite a lot. It's really quite good and really very informative, and it answers a lot of these questions. I think with a lot of confidence and clarity. So you just Google COVID-19 and you just go to the health.gov.au website, and it's actually provides with very good information.
Beautiful. I'll take a next question as well. Naz Mehman is asking, does AstraZeneca vaccine contains a live virus? If yes, which jab, the first one or the booster ones?
Okay, that's a very, very good question. So the AstraZeneca vaccine does not contain a live virus. So both the AstraZeneca vaccine and the Pfizer vaccine, neither of them contain the virus itself. What they do is they contain a particular, so if you imagine like an instruction booklet, right? So the way normal viruses work, viruses are very simple things. They're just if you imagine, it's just a little booklet of instructions coded in a protein shell, and then it goes into your body, and it's only got one purpose, which is to replicate itself, right? It just wants to make more of itself. And basically, it uses its instruction booklet and uses the machinery in your body to build itself. And that's what it does. So the traditional ways of creating a vaccine have been either we weaken a live virus and then inject it into your body so that it's weak enough that it doesn't cause illness, but it's enough for your body's immune system to recognize it and remember it. The other way we would do it is to inject a dead virus. So the virus is entirely dead, but we basically inject that into your body and your body still recognizes that. Whereas the vaccines, the AstraZeneca vaccine and the Pfizer vaccine, and this is a very, really revolutionary technology that's actually been decades in the making, and we base that on on all the scientific advances that we've had. And what it does is it actually just puts a bit of the instructions in your body rather than rather than the virus itself. Now, with the AstraZeneca vaccine, it does use basically like a dead virus shell. It uses a harmless cold virus as an envelope, so to speak, to pass on its message. So it is related to a virus, but it's technically not a live virus.
Sure. No problem. So there's so many questions going on all over media. So I will take another important question, which I can see Naz is giving you. Thank you for your response, for your answering her question. She's saying good explanation. So then the next question I would be asking from Sadia. She's mentioning, asking which allergies can be triggered by the COVID vaccine. Is there any particular sort of type or of allergy?
Okay. Well, thank you for your question, Sadia. So there's no... we're not aware of any specific allergies that can be triggered by the COVID vaccine. Now, very, very occasionally, patients can be allergic to the vaccine itself. And because they are new vaccines, it's very difficult for us to know who these patients are. They occur very, very rarely. So for the Pfizer vaccine, it occurs about, and I'm talking like a serious anaphylaxis allergy where you'll likely need to go to hospital and receive treatment. That occurs about 4.7 per million doses. So that's the data that we have about the Pfizer vaccine, and occurs 1 case per million. So it happens a bit less with the AstraZeneca vaccine, which is 1 per million doses. So that is a severe anaphylactic allergy reaction. Now, some patients have come to me and sort of describe their symptoms following vaccination, and they wonder if it's an allergy. Most of that would not be an allergy. Most of that will be an adverse reaction. So they're a little bit different. So that would be things like having having red swelling and redness of your skin at the injection site. So it might be a little bit tender, it might be a little bit itchy, and they're not necessarily an allergic reaction, but rather an adverse reaction, and they do clear up.
Answer of your question. I'll go for the next question by Sajid Turi, and he's asking, how does the COVID vaccine work, and how long does the COVID vaccine protect me? So
thank you, Sajid. So I'll answer the second half first. So the COVID vaccine is, because it's new, the only way for us to know how long it will protect you for is by collecting data down the line. So that data collection is happening now, it's happening all over the world. And then based on that data, we will make the decision. So the policies will be hatched from that data in terms of what sort of follow-up protection patients may need. So maybe they won't need anything, but maybe they'll need an annual booster shot. So we're yet to determine that. But in the short term, it should provide an excellent level of protection. Now, the how the vaccines are made, that's a much longer question to answer. I mean, the two types of vaccines that are currently available in Victoria, they're both like I said, they teach your body's immune system how to respond to COVID. and they both deliver the instruction booklet, basically. So, so just to get a little bit technical, the COVID virus is just like any other virus. It's got instructions in the middle. Right? It's got an instruction booklet for itself, covered in an envelope, right? And that's how it passes it on to you. Now, on the surface of the envelope are what we call spike proteins. So those spike proteins are a bit like, if you imagine the uniform on a soldier, right? So that's what they sort of look like. And the spike protein is the pattern on your uniform. So what is really genius about the mRNA vaccine and this sort of method of creating a vaccine is that we don't find a soldier and present it to you, right? We don't find the soldier and present it to you. What we do is we actually get the instructions of how to make the uniform and the pattern on the uniform, which in this case is the spike protein, and we get the body to make it ourselves, and then have our immune system recognize that as a foreign entity, so that we can remember and protect your body against it. So like I said earlier, there's no live vaccine. It is a very sort of, I think, special and scientifically, it's a real scientific marvel how they've come up with this. And the other advantage is the turnaround time is much faster in terms of creating the vaccine, because traditional methods require the manufacturing and the growth of and replicating a lot of the virus itself, whereas in this case it can just be the message. So that's actually one of the reasons why it's been able to happen so quickly.
All right, thank you, Dr. Lu. I will go quickly to the next question by Aisha Awan. She's asking, my question to the Dr. Stephen is that the reporting on deaths that we receive are coming from unofficial sources or government bodies are making it publicly known. So the data you are getting as a deaths, how are you going to respond to that question? Is that we're going to get it publicly?
Is that referring to, so we, if you look on the government website, there is a tally of patients who have died from COVID infection. So I think those statistics are there, and I think there's for starters in Australia, I think we do have a very high level of transparency, and I think it's very important to have a high level of transparency so that we can instill confidence in our communities. But there's always room for us to, I think, do more and communicate those things better. So if that question is with respect to deaths caused by COVID, I think that figure is there.
How about the deaths? If you can tell from that happens with the vaccine, do you have any stats?
Yeah, that's right. So to date, I believe there's only been two. I think no more than three. I think it's 2 deaths in Australia from the AstraZeneca vaccine, and I stress that's out of I think 4 million doses that have been given. So the odds of that happening is really incredibly low. And it's also important to note that the very rare clotting syndrome that it causes, which is called TTS. Excuse me, thrombosis with thrombocytopenia. So that is also a treatable condition. So it is certainly not universally, fatal. It is a treatable condition. I think so far, like I said, there's been 2 deaths in Australia from the AstraZeneca vaccine, but there have been quite a lot of cases. There have been more cases of the clotting syndrome, and like I say, it is something that we need to diagnose and treat. And it's based on this information that the ATAGI actually makes their decisions about what to recommend the government in terms of the eligibility criteria for for the various vaccines for our community.
Just to add that, Dr. Liu, I want to mention that I recently have seen Therapeutic Goods Administration website, and they always, give the reports of weekly basis. And I would like to add here with the TTS cases, they have given their stats. At the moment, they are currently treating 22 patients. At the home court overall, and out of that, there are 6 people they are having treating in the ICU. And you are completely right. There is only 2 deaths have been mentioned on their website of the Therapeutic Goods of Administration. Out of all their total numbers, 52 were discharged and 22 were in hospital. So that's what I want to mention. The stats which you are going is completely aligned what you are mentioning.
Yes, thank you, Waqas. And I think I just might add here that the risk of thrombosis with thrombocytopenia, the TTS, this rare clotting syndrome, there is quite a variation with different age groups, which is why we do make this distinction about what age groups should, in terms of the risk evaluation, we do take that into account. So the risk of it occurring in patients under the age of 50 is 3 for every 100,000 doses, and I'm talking about the first dose. So if you don't get it with the first dose, you're not going to get it with the second dose, really, because typically with the AstraZeneca vaccine, you get more side effects with the first dose and less with the second, whereas with the Pfizer, it's the other way around. So you get more side effects with the second dose rather than the first dose. But the risk of this particular clotting syndrome, which is associated with the AstraZeneca vaccine, is, if you're under the age of 50, the risk is about 3 per 100,000 first doses. And that risk comes down to 1.8 once you go into the sort of 70s age group. So between 60 to 69, that risk is 1.4. So it's actually half that of the younger population, which is why we make these recommendations.
Thank you so much, Dr. Liu. Dr. Liu, we already have spent 1 hour, and I don't want that I won't be able to invite you again. That I'm taking that so long. So I want to be quick, very shortly, and comments are keep coming, and I really would like to apologize here, to not to entertain and take more questions because the time is precious, and it's 9:15, and Sunday we have a working day tomorrow. I would like to humbly request again, maybe if we record, would you like to come again, please, on our show and discuss with our society and community, Dr. Liu?
Yeah, I'd be happy to.
Oh, thank you so much. Because I have another questions which are related to the myocarditis and pericarditis, which is related to the inflammation of the heart and all those things which recently come as well. On those questions, I have a lot because it's a completely vast and separate topic. I would like to take the last question from Dr. Aisha, which from Dr. Liu, from Aisha asking the same question in what she has mentioned before, that these deaths could merely be due to other various reasons and may not be potentially be linked to the vaccination, but how communities are taking these 2 cases is concerning. Communities would require more explanation after the death. So I think that's what we are doing at the moment. We have, as long as we have more communication, more interaction, like you are coming on the screen asking the all the silly and dumb out questions, maybe as well, taking in.
No, there's no dumb questions here. People worry about their health. People worry about their families' health and safety, and sometimes the information that we get via different media, whether it's social media, sometimes on the news, they might not do the information enough justice to say, putting it into a context, right? So if anyone has genuine concerns, any concern we want to address, yes, there are risks with the vaccination, much like there are risks with taking tablets, or there's a risk of driving down to the shops. There's a risk of getting on a plane. So there's a lot of risks, but what we encourage is to try to listen to, if anyone brings up any concerns, please, listen to them, right? Ask about their concerns, and listen to these concerns, and then try to provide some information in context. So, for instance, we've been talking about these 3 in 100,000, 1.5 in 100,000. If you actually caught COVID, the risk of quite severe blood clots goes up to about sort of 10-16%. Which is really very dramatic, and people get very, very sick. And one of the reasons is that it's not as palpable for us is simply because we might not have our lives might not have been touched by COVID in that way. And in addition to thinking about the serious harms that can be caused due to vaccine side effects for various age groups, we want to contextualize that to say, okay, well, how does that compare to dying in a road accident? How does that compare to being struck by lightning? Right? How does that compare to, how does that compare to actually catching COVID? Because, right now in Melbourne, I think we feel very safe, but last year during the, severe lockdowns, we did it. And now it's our friends and family in New South Wales and Sydney that are faced with this sort of fear. And these things will just keep happening. It's until we get people vaccinated, it's actually going to keep happening. It's important to know that people do have a choice, but we do want to guide you with the right decisions and help you contextualize these considerations so that you can make a good choice. Because we would all love for our patient to be vaccinated as soon as possible, but and things are going quite well. But more work will be done, and more efforts will be made.
Thank you, Dr. Ru. Very last question I'm taking from Mayman, and she's saying that if I have a side effect after taking the first dose of AstraZeneca, do I still have to take the second dose of AstraZeneca, and why can't she take the Pfizer? Or other things she has mentioned as well, that are we doing the mixing here as well, like as I mentioned before, what's happening in Saudi Arabia?
So at the moment, we are not doing any vaccine mixing. If you experience expected and side effects of the AstraZeneca vaccine with your first dose, it is recommended that you continue on with your second dose of AstraZeneca. Like I mentioned, if you suffer a severe allergic reaction, or if you do experience one of the very rare clotting disorders like thrombosis with a thrombocytopenia, the TTS, or if you have anaphylaxis, a severe allergic reaction, then the recommendation will change. But if you experience expected side effects, which can include things like feeling tired, having feeling aches in your body, cold symptoms, some soreness and pain at the injection site, they are things that are expected. It's actually signs that your body's working. Not to say that it doesn't work if you don't get side effects, but these are actually signs that your body's immune system is sort of working to build protection. And we do recommend you have, the recommendation is for you to go on to have the second dose of AstraZeneca vaccine.
Beautiful. That's it, Dr. Lu. I would be liking to thank you a lot for coming and being with us on for 1 hour and 8 minutes. And I would like to thanks from the people who are commenting, and do apologize who contact questions I cannot accommodate because of the short time. And as Dr. Lu already have said that, and he will be happy to come again on his availability, which I'm truly humbled and thanks again. Dr. Lu, would you like to give any message to the community as being a medical health profession and a champion of the Victorian Department of Health?
Well, Waqas, thanks for having me on your program. I think the recommendation that I'd like to make at the end of your program is speak to your friends, speak to your family about any of your concerns. Share your concerns. There's there's no stupid questions. It's important for us to hear them, and I'd like to direct everyone to reputable sites and sources of information, such as the Federal Department of Health information, the state Victorian Department of Health websites, and seeing your local health providers and your local GP, and have a discussion. Don't be afraid to reach out and voice your concerns. And what we want to do is provide you with the appropriate, relevant information and help you contextualize that into a constructive and beneficial sort of decision-making process for you, so you can make a good choice for yourself.
Thank you, Dr. Steven. Thank you so much for everyone who is watching with us. I would like to thank everybody who is sending me the messages, compliments, feedback, and please get back to us if you guys need any more further clarification. As Dr. Lou already mentioned, that there is no question which is a stupid question, because it's concerning to our health, well-being, and psychologically stresses and our mental health as well. So thanks again, everybody. We will get back next week with the next guest and the new topic. Thank you from Voice of Australia.